Welcome to the Think Factory podcast. We got one question for you. What keeps you up at night?
Hello and welcome to the Think Factory podcast. I'm Susan Kleiner, partner with Outside General Counsel Solutions, and I'm the host of today's episode. I'm happy to have with me here today Marvin Ventrell. Marvin serves as the CEO of the National Association of Addiction Treatment Providers, NAATP. He has been in that role since 2015, and he continued his 30-year career as a practicing lawyer, association director, teacher, and addiction treatment executive. During his career, he's been devoted to advocacy for populations in need and to build legal and healthcare system responses to meet those needs. In addition to serving in executive leadership roles in several national social welfare and justice agencies, he's written 2 textbooks on law and social justice, and he's written book chapters and professional articles on law, medicine, social services, behavioral health, and addiction treatment and recovery. He's a frequent lecturer at treatment programs, conferences, universities, and agencies. He's received numerous distinctions, including the ABA's National Advocacy Award, the National Council of Juvenile Court Justices Meritorious Service to the Children of America Award, and other awards too. He's had quite an impact in the field of recovery, and he's received awards for innovation, commitment, and dynamic thinking. His focus while leading NAATP has been to secure the place of addiction treatment in healthcare through the establishment of treatment programs, professionalism, integrity, and evidence-based efficacy. So thank you, Marvin, for being here with us.
I'm honored to be here. Thank you.
Yeah, that's quite a bio. You know, I feel like I feel honored to have you here since you're so well renowned, and I know that you've been on a bunch of podcasts. So, and you speak frequently. So, thanks for making the time. So,
yeah, thanks for having me.
Yeah. So, first off, in case our listeners aren't familiar, although many will be, what is NAATP?
NAATP is our country's national professional membership society of addiction treatment providers. So we are the trade association is one way to think about it, professional society of operators, those who operate treatment centers. So our members, we're a membership society, are the actual treatment center. So it's not an individual, but rather, for example, Ashley Addiction Treatment or Hazelden Betty Ford Foundation or others like that who are our members. And we have about 1,000 treatment program locations around the country who are our members. They pay dues and belong to the association voluntarily, and they do it, I believe, for a couple of reasons. One, we resource them. We help them do their jobs better. We help them be better providers and to be successful. But I honestly also believe there's a very altruistic reason why folks join the association. They want to be part of the movement of improving and developing the practice of addiction treatment in our country, and to do it as a collective body and collaborate together to meet a need that is still largely unmet, meaning most people who need addiction treatment don't get it.
Yeah, I mean, I read that your vision for NAATP, and by the way, your vision, mission, values are really great for nonprofits to take a look at. Like if a nonprofit is saying like, hey, I need a new mission, vision, values, I really think your website does a great job. And your board has obviously put in some great work on that. But I saw that your vision is recovery for all, right? That's fantastic. How does NAATP help get recovery for all?
Well, in a sense, it's thanks for liking it. I like it too. We actually, worked hard to come up with what ends up being a very simple phrase. It's hard to get there. We do strategic planning approximately every 3 years, and sometimes I think it's a little bit of a practice that companies go through, and I'm not sure how much value it has. But by the time I'm done, and we're done each 3 years or so, I realized that it has really helped us focus check ourselves and answer hard questions about what we should be doing next and, pardon me, what the outcome needs to be. And so it's a bit grandiose, perhaps, to suggest that our vision is recovery for all, but that should be the answer, right? I mean, we have this horrid healthcare epidemic crisis of addiction, substance use disorder in our country. Most people don't get help. It's a disease that kills if it's not treated. It's a disease that can be treated and people can live wonderful, successful, full lives. And so, as an association, we believe everyone, all humans, should be entitled to the opportunity to recover. And wouldn't it be a wonderful world if we had recovery for all?
It would be. And, good for you. I mean, I think vision statements are supposed to be big, lofty goals. And, I really, being involved in a number of nonprofits myself, looking at that, I recognize the hard work that went into it and also strategic planning. So anyhow, I think it's a great role model for other nonprofits, big and small, that are taking a look at that. I know that the treatment model has changed and it continues to change between modern medicine and 12-step methodology and how it all comes together. I know that, NAATP, certainly has thoughts on that, but I know that you do as well, in terms of how things have changed. So I'd just love to hear, from you a little bit on that.
Sure. Yeah, that's the sort of the big picture and how we frame our work, because we need to understand what it is we do and where it is we need to go, and you need to look at your past and where this work comes from in order to get there. And so one way to contextualize it is to say that the work of addiction treatment has really been on about 100-year evolution from what began as a social model to what has now become what we can call a medical model. And what we mean by that is much of this work began not as medicine, not as a government program, not as private industry, but rather the social construct of Alcoholics Anonymous, which itself rose out of the 1920s-ish movement called the Oxford Group. But by 1939, Bill Wilson and other founders of Alcoholics Anonymous had written a textbook. We refer to it as the Big Book. It's actually just simply entitled Alcoholics Anonymous, and it defines a program of recovery as it could be understood in 1939 as this social model where humans come together to help each other recover. I mean, in its most simple sense, what turned out to be helpful is one alcoholic helping another, right? Rather than lecturing, the concept was essentially, rather than lecturing someone on what they need to do, the AA program was founded on telling your own story to someone else you could see was suffering. So you essentially are saying, I see you're in pain. I see you're suffering. I recognize that. I had that. I see it in your eyes. I see it in your face. And I just want to tell you what happened with me. And what we then describe in the AA program is this three-part piece of what it was like, what happened, and what it's like now. And what it was like was horrible. What happened is I accepted help and entered a program of recovery. And what it's like now is that life can be very good. So that's the beginning. But having said all that, what we know now is that although those things are very valuable and continue as part of it, alcoholism addiction is a disease. It's a biological, psychological, social, and spiritual disease. So it has these four components. And the psychosocial spiritual is really in a way addressed in the beginning by AA and similar thinking. But now we have brain science. We have all this medicine and all this research that indicates what really happens to the human brain. It's a disease centered in the brain. And so we can't just stay with a social model. We have to move it forward. And so that's the history. It basically moves from those social models to an institutionalizing of the social model. So we create businesses around it and bring it into a formalized structure, but it's still basically a social model. The next phase of the four, I describe it as, is what is generally referred to as the Minnesota model. So Hazelden, Betty Ford Foundation, and others created a model whereby it becomes the 28-day program, the 28-day model, right? And so for you, and that's not a magic period of time. It's really a time that the founders of the Minnesota model could get insurers to agree to pay for, right? I mean, it's as simple as that. But it's a good amount of time. And during that time, all the therapies that existed at the time that are known to be or thought to be effective are brought to play. So that's good. But now we're in this phase of moving into medicine. It's healthcare. It has to be healthcare. In order for people to have access to care and get care, we need to follow the science, retain that which is best from our past, including psychosocial spiritual concepts, but add medicine to it. And that means everything from pharmacology to more advanced therapies, talk therapies, and put this work in the context of American healthcare. If it exists on the fringe of American healthcare, it won't reach most people. It won't be effective. It won't be the best treatment. So I would say at this point in time, that's what we're focused on, is embedding addiction treatment within our healthcare system for the benefit of all.
Right. And kind of, bringing together, with the, more current and the medicine, the medical models that are available. And I guess in some ways, something that I've heard about is like abstinence-based recovery versus, something else. And I guess with NAATP, and I guess I'd ask your own personal views, there's room for all. Like there's room for all of it, Is that the case or something else?
No, you're exactly right. There's room for all of it. There has to be. I love that one of the early principles of Alcoholics Anonymous was humility, and meaning that we right size things, we make things accurate, we don't pretend to know everything, and we're open to ideas. There's even a phrase in the early literature called that says essentially don't engage in contempt prior to investigation, meaning, don't judge. Let's let people find their way. Yes, we have some pathways, but let's honor people's autonomy and let them choose their pathway. And what we've discovered, and this is the government's view, and it's correct, the Substance Abuse and Mental Health Service Administration, which goes by the acronym SAMHSA, literally says we need to embrace many pathways to recovery. And so there are many pathways. And one of those pathways is abstinence from the get-go. And that's historically how we've looked at it. This substance, whether it's alcohol or some other drug, is poisoning you. You need to stop poisoning yourself. So the goal is to become abstinent. Well, that's not dumb. In fact, that's quite accurate. But to say the problem arose with saying, and this is particularly true when you take, for example, young people with opioid addiction, right? So you've got a heroin addiction, and what we say to this young person, typically it's a younger person, is you need to be abstinent right now, today, and then we'll work this path of recovery. Well, that's impossible for the heroin addicted brain. It can't do it, and so it's a recipe for disaster. So what I would say is our goal for people is full recovery, and that's ultimately going to require abstinence. But if you need medication along the way, opioid replacement therapies, even methadone, for example, then that's what you do. And we need to, it's called medication assisted treatment, or MAT. And we need to allow for that in the appropriate cases and find out what is medical best practice. Because to take a kid put him in treatment for 28 days, get him abstinent from heroin and turn him loose and say good luck is a recipe for death. And that's literally what was happening. These people go out, they can't not use. And now their resistance is down after 28 days or their tolerance rather, 28 days of treatment, and they go out and use because they can't not. The brain has, that has taken over that part of choice in the brain, and they overdose and die. Well, that's not acceptable. And so we need to embrace these kinds of therapies that are not abstinent from the substances, but are controlled and reduce harm and allow the person to recover. Now, it gets interesting if you were to take the next question, which is, well, what about if someone chooses to never become abstinent, that they just want to harm reduce and manage their life that way? Well, what I would say to that is that we have to honor that too. We don't get to order that person to do it our way. Now, if I would hope for more from that person than to continue on substances. But if that's what they can do to function and stay alive, and have some quality of life, then it's not for me to decide otherwise.
Sure. I mean, because people have their own autonomy as well, right? Like you need to honor people's autonomy. I thought it was interesting too, because you talk about like we need to follow the science. And when I was looking at NAATP's website, and I saw that there's this portion on it about the FORCE, I don't know if that's how you pronounce it, Addiction Treatment Outcomes Program, which I thought was really interesting. And I thought maybe you would want to talk about that for a moment, how that works. And I wasn't sure if that's a part of NAATP, or if you could just tell me some more about it, because that seems to be all about the science.
That's right. It's super important. It's the focus. So for years, decades, there has been a discussion within the field about tracking outcomes, right? We even see websites that say our treatment success rate is X%. Well, I don't really know what that means, because how do you measure success? Well, one way to measure success would be abstinence, right? But it's not the only way. The other way would be to look at wellness factors. And where did the person start and what are their wellness factors now? Wellness factors include mental health, physical health, family relationships, employment, not having trouble with the law. So all of these things are hard to measure, but can be measured. And so if we want insurance to pay for this, if we want to take our rightful place in the medical community, then we need to do what other areas of medicine do, which is to show the efficacy of our treatment, right? Diabetes has treatment modalities, including insulin. Insulin is proven to work. Otherwise, insurers wouldn't pay for it. So that research was done. Here's what happens when you take insulin. I'm being very simplistic here, but and here's the success rate of using that drug. Well, it's harder to measure behavioral health, mental health efficacy, because you don't see blood sugar necessarily having changed, or a broken leg heals, right? You can show the success of setting a bone is that ultimately the bone heals. Well, that's pretty easy to prove or to show. It's much harder to measure outcomes for mental health and substance use disorder. So we resisted it as a field for many years, but ultimately our organization said no. We cannot kick the can down the road any longer. We have to embrace scientific programs of measuring efficacy of care, and we're in the process of doing that. And that is what FORCE is. FORCE is the acronym for our Foundation for Recovery Science and Education, and it's the only program of its kind in the world. And we are taking patient outcomes from treatment centers all over the country. We currently have about 500,000 unique patient episodes to study, and our research foundation studies those and looks at what takes a look at the patient when he or she entered care, what's happening during care, and then what happens after care. And by doing that, by tracking those individuals' pathways and with the treatment modalities that were implemented, we can show what works and what doesn't work. And also what works for whom and under what circumstances and what dose. We have medicines and we think of taking a dose of medicine. Well, we can also think about taking a dose of treatment. So, for example, sessions of talk therapy would be a dose of treatment. 28 days or something in residential care would be a dose of treatment, big dose of treatment. But so would certain, anti-craving medications. And so we need to look at these doses of care and see what the patients are ending up with. And our recent reports, we have 2 annual reports now, demonstrate very clearly that treatment works. We have to be able to say that. We know it. We've always known it and sort of said, well, duh, we know it. No, you can't just know it. You have to be able to demonstrate it scientifically or it won't get paid for. And that's really what the foundation is all about.
Well, good thing that, your initial reports show that it works.
Yeah.
And also great, though, to bring together different centers, right? To have different places all come in, under the same categories. They're measuring, using the same variables so that you can kind of comprehensively look at it. And I read here that, the demonstration of treatment effectiveness can influence public opinion and public policy in order to reduce stigma and increase access to quality care. And, that's really everything, right? I mean, I think stigma keeps so many people, unable to get recovery, to become recovered, to get treatment. And so all of this, the science and the good work that you're doing helps with that. I want to kind of turn at this point because actually one of the things that I think is so fascinating about you is your career path. And obviously, as a fellow lawyer,
Right.
and you're now out there as an executive director of this, great organization that's doing such good work. I kind of scratch my head and I go, how the heck did you go from being, I know that you did a lot of trials, you were doing, I think you were in the field of juvenile justice and, certainly some social good, but how do you go from being a trial lawyer to heading NAATP? Like that's something. How did you do that?
Well, yeah, I mean, you can't make this stuff up, as what one using a different word for stuff, that as one of my colleagues once told me. So I would love to tell you that I had it all planned out and this was a career pathway and I followed it, but that would be untrue. I think one of the things you learn as you mature in your professional life is that you can have a plan, and it's probably a good idea to have one, but life's going to take you in certain directions. And for me, I think what I've done is pay attention to the signs that the universe gave me a little bit so that I could direct myself, and then lots of opportunities. I've received wonderful opportunities in my life. I'm super fortunate. And I was a kid who sometime in high school, actually, I kind of remember it during my freshman year, decided I wanted to be a lawyer. Well, that's not the structure I came out of. I came out of a working class family. My dad ran the Firestone store in Billings, Montana. He was not college educated. Neither of my parents were. And somehow I ended up, there are 3 siblings, my older sisters. One is a CPA in Los Angeles. The other is a college professor at the College of William and Mary, and I end up being a lawyer. So we somehow, I believe, received from our parents several messages. One was to be self-sufficient, to be strong. We had World War II Depression era parents. So you know what that's like. That's, get up in the morning and get to work and accept responsibility and quit whining. Whining was not allowed.
Right.
And my dad would frequently say, quit bawling or I'm going to give you something to bawl about. He never gave us something to bawl about. I mean, there was no corporal punishment. I don't know, but it seemed to work. So we quit our whining. But anyway, I went to law school and, was straight through college and law school, practicing law at a very young age, and became a trial lawyer. And I loved the practice of law. I really value the practice of law. I think that lawyers are responsible for the quality of justice in our country and provide an indispensable role. Shakespeare said, if you want a disorganized, destructive, chaotic, anarchistic society, first thing you do is kill all the lawyers. And people say that phrase like it's a good, like they don't know what the context of it was. Shakespeare was saying, if you want disaster, first thing you do is kill all the lawyers. Well, so that's what I did. And then an opportunity was presented to me through my work in juvenile justice to run a national organization for children and families in crisis in the court system. And it's called the National Association of Counsel for Children. And so suddenly, at 10 years of practice, I took over that organization, which I then ran for 15 years. And the work was analogous to the work I do now. It's association directorship. And during that time, I continued to do some work in the courtroom, but I also taught law at I taught law school and became a instructor for trial advocacy with the National Institute for Trial Advocacy. And so all of that presented itself. And then here's the thing. I became addicted to drugs and alcohol. Somewhere around age 40, I can't place an exact time on it, a switch got turned from my overuse of alcohol, which, by the way, is a syndrome of the legal community. Lawyers have the highest rate of addiction in our country by twice the next highest profession. It's a real epidemic in the practice of law because it's a certain kind of personality and stress. You medicate stress with drugs and alcohol, and because you think you can get away with it because you're special, which you can for a little while, until ultimately I became fully addicted to alcohol. And I had wonderful people around me who said, you need help, you need to go to treatment. And so I went, and I haven't had a drink since. And that was like about 16 years ago. And so my own recovery then informed my path forward. So after some time in early recovery, I pursued work in treatment programs in the Denver and Colorado area, which I did for several years, which then led to, and I'll remember the day, I was one of the executives at Harmony Foundation in Estes Park, Colorado. And I had kind of completed the project that I went to work there to do. It was about a 3-year project. And so I advised the CEO, I was not the CEO, that I thought it was time for me to pursue something else. And she said, and I remember this very clearly, Marvin, I never want to talk a man into staying somewhere he doesn't want to stay, but did you know the directorship of NAATP is open? They're looking for a new boss. I think you'd be perfect for it. Well, there's the universe again. What? I'm a guy that went to treatment not that many years before with no clue, frankly, as to how any of this works. But ultimately, embraced it and was saved by it. And the next thing I know, I'm CEO of NAATP. And that was, almost 10 years ago.
So there's a lot there, to unpack. we could talk for a long time about that. I mean, you hit so many important points. Crucial one of them is, the fact that, lawyers have, what did you say, twice the national average of
the next highest profession. Yeah.
Of the next highest profession. And, that's an issue that's also near and dear to my heart, because I'm involved with the Lawyers Assistance Program here in New Jersey, which they have, elsewhere. And, yeah, that's real. So I just wanted to kind of highlight that in case we have lawyers listening. But so what I heard from you is, being open to opportunities in the universe. And it sounds like you always kept working and, you kept your options open. It goes without saying, like, don't burn bridges, the fact that, this other person said that you'd be a great fit and taking chances,
Yeah. Well, Yeah, is the hard part, that you want to be responsible. There, my father's view was never quit a job until you have the next job. That was just unthinkable for someone who was raised in the Depression. That would be the most irresponsible thing. Those of us who are more fortunate maybe have an opportunity to take larger risks and still protect our family and provide and all of those things. So I do think that's a hard calculus to determine, is this a smart risk or is it not? And ultimately, you know, um, you kind of have to figure out a philosophy, and mine became do the next right thing. You know what's right, Marvin? You know what is good and decent and right. Try to do that and trust that it will work out. And it has for me.
Yeah, very good. So along those lines, what advice would you give to your younger self? Like if you could meet your younger self, what would you say?
Somebody asked me this recently if I had any regrets because of my use and recovery. And so what I understood that person to be asking me was during your time of drinking socially or whatever, do you regret that? And I answered no, I don't. And I ended up in a really wonderful place. Now, I don't wish the disease of addiction on anybody, but ultimately I ended up in a really good place. Now, but do I have regrets, or would I have advice for my younger self? Absolutely. To suggest that I didn't do things wrong, or I couldn't have done better would be extremely arrogant. I totally could. I think I would. Well, a couple things. One, I raised two wonderful children, and they are wonderful and they're doing great. But as a parent, I was a very young parent. I would urge myself to be more empathetic, more tolerant, and not be so darn hard on them. I really pushed my son, especially super, super hard. He's very successful and all of that. And there's a balance there, but I wish I had been a little, frankly, more uh, less love through the harshness. I think I pushed too hard and demanded so much of my children that I wish I had been a little more nurturing at times, I think is what I would say. In terms of telling my younger self, I would say, um, be far more tolerant of other people. I think that I saw the world as a young man, in very clear black and white terms. I tended to be arrogant and judgmental, and I would tell myself, if you relax a little bit and are less judgy and kinder to yourself. I mean, that's part of the situation with being critical and judgmental, is I think that it relates to my own to your view of yourself. And you have to be kind to yourself. And I would say, slow down, Marvin. Be kind to yourself and recognize, as my dad once told my sister, when she was being a little judgy. Her name was Teresa. He still had his Brooklyn accent, so he said Teresa. He said, Teresa, um, it takes all kinds of people to make a world. And so he was telling her, and she's never forgotten it, we're all in this together. It's a village, and let's not be arrogant about how great we are.
Oh, 100%. Yeah. I mean, obviously, what I heard from that is that, there's gratitude, like you're grateful for what you went through, right? Because it gets you
Yeah.
where you are today. And I think also, on the judgment piece, when we're being super critical of others, or super judgy, we don't have to look at ourselves. So it makes sense to kind of,
Yeah. Yeah.
show yourself some self-compassion, as well as for those around you.
And let
So,
me just also say that those
yeah,
are recovery principles, right? This is, you know, all of these human shortcomings including grandiosity and arrogance and perfectionism. Those are all things we look at in a program of addiction recovery. And they're human traits. They can be viewed as shortcomings. In some ways, they're assets, right? It's good to strive for excellence. It's not good to run over people in your striving for excellence. And so these things that you were just asking about my younger self and how I feel about all of those things, these are all things that we talk about in programs of recovery because they lead to a fuller, more meaningful life.
And more authentic, right? Like you're so authentic with, with what it is that you're saying. And I'm sure that anybody listening could appreciate that. So real quickly, like, what are you looking forward to? Is there something coming up with NAATP, or do you have some speaking engagements or something else that, you're looking forward to professionally?
Well, I'm 64. I feel like I'm 44. I honestly do. But I will say that what I'm looking forward to at this moment is going fly fishing this weekend. But that's my personal life. But in terms of professional work, I look forward to continuing to grow the association with our team and really see the research foundation take off and have the impact that it can. I think it's the future. The Foundation for Recovery Science and Education is really the future of our association. This outcomes work is what will ultimately make the biggest systemic difference. There's all kinds of ways to attack this issue, but at its most basic level, we have to change the structure of our thinking about addiction, and the science will allow that to happen ultimately. And so I really look forward to continuing to grow it.
Well, thank you. Yeah, that sounds great. And I'm glad that we had a chance to talk about that. If people want to read more about that research, they can read about it at naatp.org, where they can also, read more about you and about the organization. And, I see that you do a lot of webinars, and I know that you have an annual conference. So like all sorts of good stuff. The last thing that I'm going to ask you, I feel like it's a bit intrusive, but we ask everyone that appears on our Think Factory podcast. I think I warned you about it so that you're ready, although you seem pretty authentic and forthcoming. So I'm not sure that there's anything that I wouldn't be able to ask you, but what keeps you up at night?
Yeah, well, I would start my answer to that by saying nothing. And literally nothing. I don't not sleep anymore, right? I think that it's a result of again, recovery, right? Sizing yourself. I don't control this universe. I have a small role to play. So get over yourself, take a deep breath, and go to sleep. So I actually there's this wonderful part of recovery that allows you to relax and go to bed after a hard day's work. It's pretty wonderful. But speaking more metaphorically, what keeps me up at night is this, look, it's stressful to run an association that has an important mission like this. I want to make sure that I worry about continuing to be well enough funded so that I can keep this wonderful team together and pay their salaries. I want to be a mentor to people who work in this field and who work for me and are younger than me. And so I stress probably a bit more than I need to about making sure that our association is successful. It's always a funding issue running these associations. Getting adequate funding to do good work is a constant struggle. And so that can be tiresome, and I worry about being able to keep it going. I worry about 800 people a day dying from addiction, and that's the number. 300 a day from illicit drug use, and then when you add alcohol to that, which is in fact the biggest killer, we're losing 800 human beings a day who could be saved. And that's why we do this work. And it's horrible, and it seems insurmountable at times. But all you can do, I think, at the end of the day is get up again tomorrow and do the best job you can, one day at a time.
Thank you. Yeah, good words. Well, Marvin, I want to thank you for being here with us today. And be sure and check out our other episodes of the Think Factory podcast, where my colleagues and I highlight other important industry topics and businesses. You can go to our website, www.ogcsolutions.com, to learn more about my law firm. You can also click on the Think Factory to see our publications and podcasts. I'm Susan Kleiner. Thank you for tuning in. Thanks so much, Marvin, for being here today. And see you next time. Take care.
Thank you, Susan. Bye-bye.